Hello, my name is Matt. I'm with the University of Utah School of Medicine. In this segment, we're going to be covering the head-to-toe assessment on a patient. First things I want to do as I'm coming up to a patient is make sure I'm safe. I got to remember I'm number one. Two, I'm thinking what happened to you? What's the mechanism of injury? How did they fall? Did they fall climbing? Is this a bike crash? Ski accident? Did they just go through some rapids in a river? Three, none on me. I'm gonna make sure I have my personal protective equipment on, so I would glove up. Four, I think, are there any more? Are there other patients? Could this be a mass casualty incident? Five, I'm thinking, are they dead or alive? So I come up to my patient, I like to introduce myself, say, hello, my name is Matt, I've got some medical training, can I help you out? I always like to approach my patient from their front, so they're not twisting their neck or moving around to try to see me. So after I get my consent, I'm gonna approach my patient, I'm gonna start at their head and move all the way down through their body, assessing their body. So I'm gonna feel around my patient's head, making sure the skull is intact. I can come around the back of the neck and walk down the cervical vertebrae, feeling for any step-offs, deformities, crepitus in there. I can check my patient's ears, see if there's any cerebral spinal fluid coming out. And I'm gonna check behind the ears for any bruising behind the ears as well. I can check the eyes, feel structures of the face, feel their nose, make sure that's all intact. I can ask my patient to open their mouth. I can ask them, can you run your tongue along the inside of your mouth? Do you taste any blood? Does anything feel out of place? So moving on from the head, I'm gonna look at my patient's neck. I'm checking for symmetry, seeing if there's any tracheal deviation or jugular vein distension. I'm gonna come down, I'm gonna feel the shoulders. I'm feeling with big, broad professional hands. I'm feeling along the collarbones, making sure those are all intact and there's no deformities in the shoulder. I'm gonna come down to the chest. I'm gonna put a hand on the center of the chest, ask my patient to take a big deep breath in and out. And again. And I'm making sure all the ribs are intact, the sternum hasn't been dislodged. Now coming down to the abdomen, I'm gonna divide it in 4 quadrants and palpate. And I'm doing a big rollover with my hands, feeling for any deformities, any tenderness growing. Is my patient guarding? Are they reacting to pain when I push? And then I'm gonna come check my patient's back, right? Stick my hands out, make sure there's no bleeding, and then I'm gonna lift up, right? Feel if there's anything going on in the back of the kidneys, see if I get a pain response from my patient. Now I'm moving down to my patient's pelvis. Find the iliac crest where the bones protrude. I'm gonna push down and then I'm gonna push in. 2 separate motions. I'm gonna make sure not to rock the pelvis. I move down towards the long bones of the legs and I'm gonna push opposite. I'm gonna push opposite each direction, on each femur. I can check mobility in the knees. While I'm down here, make sure those bend properly. Push opposite on the legs, and then I'm going to move down to the feet. I want to check that my patient has circulation, sensation, and motor function. So I'm going to ask, can you push down like a gas pedal? Can you pull your toes to your nose? Can you tell me what I'm doing?
Tapping.
Can you tell me what I'm doing?
Scratching.
Okay. I can check cap refill in nails, but she has painted toenails. So I'm just going to pinch right there. I'm going to make sure it goes pale and then blood returns within about 2 seconds. Now I skipped over the arms when I was moving down because I like to come back to those. I'm going to push opposite and I'm going to push opposite. I can grab my patient's hand. I like to grab both at once so I can tell if there's any differences. Can you squeeze my hands? And then I can do the same thing for checking cap refill as well. Can you tell me what I'm doing?
Tapping.
Can you tell me what finger I'm touching?
Pointer.
Okay. I can check mobility in each shoulder, see if they have full range of motion. At this point, after I've done my head-to-toe assessment, I would make a plan for how I'm going to treat or fix any injuries, how we're going to evacuate the patient. I'm Matt Cherico with the University of Utah School of Medicine. This concludes our segment on the head to toe assessment.